Hi, everyone, and welcome to Chiromo Hospital Group Live. We do this every Thursday, and this is done with the purpose of creating awareness on mental health, matters mental health. Today, we'll be discussing epilepsy and mental health. And on the panel with me, I have Sylvia Moraa Machabo, I have Grace Gashanja, and I have Sharon Bou. I'll let them introduce themselves, and then we proceed.
Starting with. Hi, thanks, Tiffany. My name, as mentioned, is Sylvia Moraa Machabo. I am a parent to three children, two of whom are on the autism spectrum, with a comorbid of epilepsy or convulsive disorder. I'm the founder of Andy Speaks for Special Needs Persons, where we champion for inclusion of persons with neurodevelopmental disabilities, for inclusion in matters health, education, and social protection. And on top of that, I am the CEO for Tech Hub Holdings Limited, where we do PR branding and prints. And you're currently reigning Miss Africa Elite 2020-2021, Miss Africa United Nation 2020-2021, and Elite Face of Africa same 2020-2021. I'm a Rotarian for the Rotary Club of Modaiga and currently the Assistant Rotary Public Image Coordinator for Africa Zone 22. Thank you.
Wow. Thank you. Grace, you can introduce yourself.
Thank you, Tiffany, and thank you for having me today. It's indeed a pleasure to be with you. My name is Grace Kasandra. I am a psychologist here at Chiromo Hospital Group and also the wellness in charge. A very passionate mental health champion and mental health advocate, and very pleased to be engaging in this conversation. Thank you.
Thank you. So I can see Sharon has just left, but we proceed all in all. So when we hear the term epilepsy, what comes to mind? What is your definition of epilepsy? Sylvia, let's start with you and maybe assume that order as we go on.
Okay, thank you very much for the question. So epilepsy to me is a disorder defined by recurrent and provoked seizures. And the seizures are disruptions in the electrical pulse patterns of the brain, which is mostly caused by brain cells moving simultaneously at a faster than normal rate. And it can be seen physically by different body movements that can come with stiffness, rolling back of the eyes, either full body stiffness or jerking of the body, partially or wholly, depending on the intensity of the seizure.
Right. Grace, what are your views?
I think Sylvia has described what epilepsy is quite well, but I'd just like to add on to the fact that one of the main, but a few of the causes of epilepsy include maybe head trauma. We do have people who've experienced or start experiencing epilepsy as a result of trauma to the head, maybe through an accident or a hard fall. Often in the mental health field, we do see them in people who are withdrawing from alcohol. Sometimes they're not even triggered by any accident or incident that happened, but in such cases, maybe it's just genetic and they start off from childhood. And those are just but a few of these causes that we have of epilepsy present.
Mm-hmm. So I like to maybe break it down for people who might not understand epilepsy in layman's. So I like to put people in perspective. So we have we normally in your offices you normally have the files, the cabinet files. So for instance, when you open the cabinet, the file cabinet, and then you throw the files up, all the files up. And then you take the files and put them back in the right cabinet. I think that is what happens when someone has a seizure, an epileptic seizure. It's like everything goes haywire and then they come back again. So I'd like to use that term as that description to describe epilepsy or an epileptic seizure. It's the same way maybe a computer can have a virus, and that virus can trigger maybe a malfunction in the computer. So I have been reading stuff about epilepsy this week, and I have seen people trying to make it simpler to understand epilepsy, and they've given those two as an example. So as we go on, I'd really like Sharon to take us through some things here, but because she's not here, Gigi, since we're talking about mental health and epilepsy, do you think that there could be a possibility that people living with mental illnesses are at a higher risk of developing epilepsy? Do you think it's possible?
That's a very good question. I'm not sure how to approach it, but I'll use one of the most common cases where we do find someone with a mental health problem developing epilepsy. Earlier on, I mentioned that one of the causes of epilepsy, or one of the causes of epileptic seizures, is actually alcohol abuse. Yeah. Mm-hmm. And what happens more often than not is that when someone has been taking alcohol excessively and then they're withdrawing from alcohol, they tend to get those epileptic seizures, or what that now, the way you described it. Their brain cells become all haywire and then they get back to being normal. In alcohol, they call them RAM fits. Yeah. So in such situations, especially with people who have gotten epileptic seizures or those RAM fits quite often, someone can actually develop, because of maybe those hard falls that they may experience at one point or another, they may experience epileptic seizures in the long run. But what often happens actually is that as a result of epilepsy, some people do tend to develop mental health issues. So often we see epilepsy leading to mental health issues as compared to mental health issues or mental health disorders leading to epilepsy.
Okay, thank you for that. Sharon, are you with us?
Yes.
Thank you.
Zoom has allowed me to get back in.
Yeah, it's okay.
Yeah.
So we had just started by defining epilepsy. Maybe you could give us your definition of epilepsy as a person with lived experience.
Right. So epilepsy for me is simply multiple unexplained seizures. So if you have one, then you're not necessarily, you don't necessarily have epilepsy. It's probably a one-off seizure. But if you have several and several over time, then that qualifies as epilepsy. And it's basically where you have neurons cross-firing in the brain. And so, yes, at the end of the day, that is what epilepsy is.
Okay.
Yeah.
So, thank you for that. We had just spoken about the possibility of someone living with mental illness being at a higher risk of developing epilepsy, and Grace took us through that.
Mm-hmm.
Something I'd like you to make us understand is in the spirit of epilepsy awareness.
Mm-hmm.
Could you briefly take us through the reality of living with epilepsy in Kenya?
Well, I'll give my perspective, and then I will give sort of some general views or points of view that I believe cover for a lot of us in the country. So in my view, it's ended up being a lifestyle adaptation, and I say that because
I think we lost Sharon again. It's okay. So Sylvia, I'd like to throw you under the bus kidogo and ask you about, as a caregiver, not necessarily directly for a child with epilepsy, but with autism. what is the reality of your children? What is the reality of them living with a rare condition or the non-communicable disease, which is autism in this case? What is the reality in Kenya? What is it like in Kenya?
Lost you or
And
you've
even
lost?
as a caregiver.
Okay, you'd gone mute for a minute, but I think I get the gist of the question. The reality on the ground, especially with autism. First, it is something that finds you as a caregiver unprepared for, because some of these things is things we learned in textbooks, but you never actually experience. You've not experienced it. You don't know how to handle it, because it was in class 6, I think, when we were learning this thing. So now this is real life 20 plus years later. And I can recall very well the first time it happened, my child was only 3 months, but then it started slowly. And according to the description we mentioned, remember, you can have the convulsions first before it can actually be categorized as epilepsy. So the very first time was quite tough, because you look at your child, they're there, they're shaking, their eyes have rolled back, they're almost lifeless, and then there is always the sound that comes with it, and you have no idea what to do. And remember, depending on what point in life that the convulsions and epilepsy checks in, because we've also seen other caregivers and parents who epilepsy starts coming at the teenage, because of the changes in hormones. Your autistic child has been okay, but now you're hitting teenage, then now they're starting to become epileptic. Or we have seen increase now, like in the weather, the way now it was sunny, now it's cold, then there is increased now convulsions. So these are all things that come and they're thrown at you and they're new. First of all, it finds you unprepared. And for us with living with it as a comorbid to other disabilities or other conditions, you find it is very hard to actually accept and embrace it and to get used to it, because every time a convulsion comes, it's all different and it's all new, and it takes you to that pain level that as much as you would want to embrace and say it is okay, it never feels okay. Because as a parent, I cannot genuinely understand what my son is going through at that time, right? All I see is what I see from his body reaction. On top of the body reaction, there is the fatigue that comes after that. And the sad reality is, when he was younger than then, we got the full-blown convulsions. My son forgot all the milestones he had achieved. So for me, the convulsions came as something that was robbing life and progress out of my child. And it's one thing that we wish away, but you know that it's not that easy. And then getting used to giving them medication every day, and it's just not easy at all, having to deal with the complications of now the autism side of it, plus the comorbid of epilepsy. It can really, really take a toll on you, both mentally, physically, economically, name it. Yeah, and even socially, because you're always afraid of leaving your child. When will it happen? Will people know how to take care of him? Will he fall safely? Will he, there is all, I can't even sleep well because all the attacks come in the morning. So from 4 a.m., you're like a half light sleeper. You have to listen very keenly. Even if someone moves a bit, you hear, because you see, it just happens. And the one thing that you're afraid of is you don't catch it in time, and then it runs for so long that it damages your child. So those are the fears and some of the experiences that it is realities as a caregiver.
Yeah. They say that special needs parents are like superheroes. They're like Captain America, they're like Batman. I like to think that's true. Grace, would you like to give your thoughts on the reality of people living with epilepsy in Kenya?
Well, I'm hearing Sylvia speak, and I'm just imagining just how much of a lot of work it is to just completely dedicate your life to your children like she has. And at the same time, I'm also thinking of a relative of mine who their child with epilepsy is now an adult. But somewhere when he was much younger, when he was in primary school, the seizures used to come in so uncontrolled, and though he was on medication, it actually affected his self-esteem to a point where he dropped out of school and couldn't go to school. At one point, he had a seizure in the middle of the night and he fell off bed, and that led to an elongated hospital stay. And so now he is in his 30s, but stays at home all day. He's a twin actually, but the brother now is 100% his caregiver. So a lot of the family has actually dedicated their life to helping this person and supporting this person. But at the same time, I also know of yet another family where the person living with epilepsy was able to have quite a fruitful life, able to go to work, manage the seizures quite well. So I think everyone's experience is different, and the challenges that they go through is quite different. But what I'm also hearing is that there is hope, and it's actually possible to do quite well and to be supported, have the right support system around you, and deal with all the challenges that you're going through. So what I'm saying is big up to Sylvia and all the mothers and fathers and sisters and brothers, to people living with epilepsy, and being able to assist them and be present for them unconditionally, irrespective of just the strain that it actually puts on you.
Okay.
Thank you.
So in the same spirit of talking about caregiving and individuals, maybe we can start with you, Grace. What do you think are the mental health impact on individuals who are living with epilepsy, and even on their caregivers? What do you think they go through that may force them to have mental health implications or mental health challenges?
The challenge with being a caregiver, and this one happens not just to parents or caregivers of people living with epilepsy, but even any other long-term chronic condition that we're experiencing, is that there's always that aspect where you're living your life, and then you have this child. There's the aspect of the expectations. I think every mother, when they're expectant, they have these dreams, these ambitions that the child is going to be able to achieve. And then you give birth to your child, and somewhere along the road, somewhere along the path that you thought their child is going to walk at this age, go out, have fun, maybe learn to ride a bike, be independent, go to school, make friends, and then something happens, something that is completely uncontrollable, completely unpredictable, because we're saying one of the causes of epilepsy is genetic, and you can't really tell that this is going to happen and at what point it's going to happen. So what happens is that what we have seen happen, and I think a lot of moms can actually relate to this, is that there's that complete sense of loss, because what your expectations were, the things that you thought would happen, now you have to literally recalibrate your life and recalibrate the expectations that you had of this child, of the life that you actually dreamed and prayed for your child to be able to achieve. And one, there's that sense of loss that is consistent and persistent throughout. And then in addition to that, there's that aspect where you're pouring consistently into this child. If it's social engagements, if it's play dates, if it's leaving your child with a help, then you have to be a lot more cautious of all these things. That is, if you're even able to do that, if you're able to get help that understands that this is epilepsy, that this person needs to take meds at this time, that you need to be overly cautious of all these things to avoid. How best do you handle when your next of kin gets a seizure? And this is not just in childhood, but also in adulthood. And then bringing up this child in a way where they get to a point where they can be they can be dependent on themselves, where they're able to know, when am I going to get a seizure? How can I manage it? Can I be able to tell when the auras are coming so that I'm in a better position to maybe prevent any harm that's coming? If it's friends, also educating them, So it comes in with a myriad of events and challenges that you have to go through. And what happens for these people is that sometimes is that aspect of anxiety that can develop in the parents. You're always worried, you're always anxious about this child. And if this is not the only child you have, then the other children can also get affected, because they may feel that you're paying too much attention to this one child, and they're also your kids, so they also need that other level of attention. So being able to strike that balance can also come in as a challenge. because of that aspect of pouring your all into these individuals' life, into this person's day-to-day experiences. You may feel some people do develop aspects of depression, and caregiver fatigue can also come out, or caregiver burnout coming in. So these are all things that we now need to be very cautious of, even as caregivers, and we always inform the caregivers, are you taking care of your mental health, even as you're being there and being present for these people, being there and being present for your child, for your sister, for your brother, for your parent? Just but a few.
Sylvia, as a caregiver, specifically as a caregiver, what impact does caregiving for a child with special needs, what impact does it have on your mental health? Maybe I can ask the question again.
No, I lost you for a few seconds. Yes, kindly, please. I lost you. Yeah, caregiving.
It's okay. I'm asking, as a caregiver, and specifically for a child with special needs, what impact does the caregiving journey entirely, what impact does it have on your mental health?
The first thing, in all honesty, the minute you get to hear about either the diagnosis of special needs and epilepsy is depression. Depression, stress, however you want to look at it, but there is that sense of denial that you want to mourn and question and ask yourself, why me? Why my child? Why did it have to be for? What did I do wrong? That is a typical human reaction the minute you learn of some of these disabilities and challenges when you're in your child. And going through that process is one of the hardest, because no one prepares you for it. And most of the times you don't even identify yourself when you're actually going through it. Where if I was to personally relate, the time I went through it, I was lucky enough, I had gone through depression before over something different. So I could identify something is wrong. I'm going down the valley again, and I need to pull myself out of it. And it takes time to accept. For my middle child, there was no options, because there was too many things going on at the same time. He was a newborn. The comorbids were too many on top of the convulsions. But then for my second child, when he started getting involuntary convulsions, I was in total denial. And you'd think it would be easier because the first one already has it, because it took me around three years, because I even put him on medication. The minute he stabilized, I pulled it out, because I really wanted a normal child so badly. Not that, like, I just wanted him to be okay. I wanted him to be without any faults, for lack of a better word. Because sometimes you look at your children and you're like, this is such a beautiful child. Why do they have to go through this? And you feel like if you could take away that burden and carry it for them, but then we all know that's impossible. And I always like saying that the thing with special needs children, it's not like the way you can go buy something at the supermarket and say, I don't like it, and put it back. God gives you that child, and you have to embrace them and walk the journey no matter what. So the challenge of accepting, and then actually now moving to the next step of, okay, we are here. So what do we do about it? Do I do something? Do I now take him to hospital? Can I put them on medication? And then there is the challenge we have in terms of, no one tells you what this is all about. You're just given a diagnosis, and you're told that we need to see you after this long and this long. And even the way, like, this is now going out to the medical fraternity, there is lack of empathy. And you find there is enough judgment already from the family. The last thing you need is from the person who's supposed to be understanding what is going on, also blame shifting and trying to get through that journey of self-questioning of where in your family is this coming from? As much as it is a point in how we're trying to find the source and the cause of some of these challenges, they need to be a bit considerate, because it affects you as a parent, because now you start questioning yourself. And we even have parents who are afraid of giving birth again, because you feel like, okay, I'm carrying this, let me use that word, curse, or this burden, and it will recur again. So you live in fear constant. Then there is the managing of it. It's not easy. Like I said, you can't quite sleep, because every time I hear a certain noise, I'm afraid, oh God, don't tell me we're going to go through it. Or if I see today my son is very clingy, he wants to sleep in my bed, I'm like, okay, we are on standby that we might be having a seizure in the morning, because constantly for us, it comes early in the morning. So from that 3 a.m., 4 a.m., you can't quite find sleep. And it's not something that you can delegate, even if you have like a nanny. It is your child. You're the one who understands. You're the one who has to be there unconditionally for them through it all. And then there is the challenge of being the advocate. So you can find all this responsibility weigh you down, and subconsciously you get so drained. But I believe God's grace is sufficient, because we finally find out one way or another, we manage to get through it. Like you said, we have superpowers, and I think God's grace is one of them. Yes.
Yes, thank you so much, Sylvia. I like to think that the way a parent will deal with maybe the diagnosis or an injury or the trauma of their children, the way they're going to cope with it directly affects the support they will offer their child. And sorry?
The way a parent would deal with, sorry, lost you.
I'm saying the way a parent copes with the diagnosis or the injury or the trauma of their child directly affects how they're going to support the baby or the child. And I think you're doing a really good job being a parent of 3 kids with special needs. You're doing a good job. Yeah. So Sharon, we were just talking about the impact of mental health on individuals or caregivers for people living with epilepsy. Maybe it's just it would be important to hear it from your own mouth as a person with a lived experience. Maybe you could take us through what mental health challenges you've gone through as an epileptic. Yeah.
A person living with epilepsy.
A person living with epilepsy.
Yeah, we prefer it phrased that way. But first of all, Sylvia, wow, kudos, by the way, for that journey and for that strength. His grace is sufficient. So for me, actually, I guess similar to Sylvia, I had a case of depression prior to that, even prior to my diagnosis. So one of the side effects of the medication that I'm on is that you get a proneness to depression. So from about mid 2016, by then I hadn't had my diagnosis. I got my diagnosis in 2018. But around that time when the seizures came back, then I immediately went back onto anti-seizure medication. But then I could sense myself, going down the rabbit hole, as it were. So at least for me, that's my experience. One of it is you are prone based on the medication that you have, and then obviously, first I would imagine, probably a lot more for caregivers that there's that mental strain, if you like. For people living with epilepsy, there would be as well, because you do feel you feel challenged. You're restrained, or it's difficult for you to do certain things. And I think if you stay there mentally, then yes, you're definitely prone to depression, prone to anxiety, prone to sleep disorders, and all these other things within the mental health bucket. So yeah, so that's a high likelihood, I would say. And actually, just before I dropped off, I was explaining my personal journey with it, and I think a couple of things that happened to me that I would really not like to see for other people like me. My diagnosis came as an adult, barely 2.5 years ago, and it was as a result of head trauma. And so for a long time, I didn't even know what was wrong with me. So, and then previously, when I had my first seizure, I was misdiagnosed with a heart condition. So I just feel like there's a lot of things like our medics, and even down to just clinical officer level, need to be better equipped to be able to diagnose some, let me call them basic or simple conditions, to be able to just have a better idea of this is what it could be. And then what's the other thing I would say? Yes, so people, yes, react differently to the diagnosis of epilepsy. There are those who, you know, you have your children born with the condition, which is, you know, I'm sure very difficult for the parent. There are those, again, you know, who you get it as an adult. So there's, you know, all that dealing in that sense. But I think the big one, and I think Sylvia alluded to it, is just the stigma. You know, and it just comes out from a lot of ignorance. For myself, I suppose, you know, based on what I knew and how I lived, I know I wouldn't directly stigmatize someone, but I didn't really understand. I didn't really know what it was about. But now on the other side, then I'm really passionate about creating awareness, because I feel like too few people know about epilepsy. Many people are scared. Many people, you know, think you're bewitched. It's a very, very misunderstood condition. And so I'm passionate about spreading the word and helping, you know, people to better articulate their stories, so that we just have many more people who know, because then I feel like that's half the battle that is won. Because at least if you understand, if you have an idea, then you can be more empathetic to someone or to people living with a condition.
Okay, thank you. Which brings me to my next question in regards to the stigma and the proper equipment or infrastructure for diagnosis for matters related to epilepsy. So, Grace, what do you think is the role of the society and the government in ensuring the welfare for people living with epilepsy and even the caregivers extensively?
Okay, thank you for that question, Tiffany. Hearing it and also just knowing is that one of the things that we do not have as a society is the aspect of creating awareness about this being real, this being something that affects so many people, and not just here but all around. You know, so the role of us as a society in our own small way. And I'm really glad that we're doing this with this team of really beautiful people who are out there spreading awareness in their own small way, talking about their experiences, you know, because that's actually what we can do within our society, how we reduce these aspects of stigma. Because indeed, by nature of our society, by nature of us being Africans, these are things that we have rarely grown up seeing, and when it happens to us, it comes in as a shock. So this stigmatizing comes with us talking openly about it, talking to our friends, talking to our loved ones, and even we as ourselves just accepting the fact that once in a while you meet someone who is different from you, someone who has a condition or an illness that you may not 100% understand, but being open to hearing them out, being open to assisting them when they ask for assistance and when they need assistance also goes a really long way. So as a society, as a public, just generally being a lot more open, practicing what we preach and accommodating, being a lot more accommodative of the people that we meet on a day-to-day is really big on our role. In terms of government, I'm not very sure I'm in a position to speak for them. But I'd probably like to hear what Sylvia has been doing with as an advocate for epilepsy and other people and other conditions that we see quite often with Andy Speaks. I'd like to hear what she has been doing with government, because I'm sure at one point or the other she's engaged with them.
With government, it's been a battle we're having and still having with the Ministry of Health, because for us to find our children need the support for both the Ministry of Labour and Social Protection, Ministry of Education, and Ministry of Health to really work together. But as government would be, every ministry wants to do its independence, and you find at the end of it, it's our kids being caught right in the middle, because for them to actually thrive, we need all of them to be, let's in lack of a better word, in bed together. So you find that we've been fighting for support and for tax exemption or for anticonvulsants to be made more affordable, if not free, the same way we have HIV/AIDS meds being given, the same way we have some of the things being covered under NHIF and medical plans. And we're really looking forward to see what the currently being drafted UHC is involving with all these petitions that we have put through. I know there is a structure and there is guidelines around epilepsy that has been put in place, but sadly we are very, very good at having very awesome written policies that are not being implemented. That's the sad reality. And if we look at our education system, like we all say, the medical fraternity, how much of these conditions are being discussed in depth? Because like we've had, there was that misdiagnosis. We've also had very many misdiagnoses. So there is the missing it and the missed. There is the missing and the like misdiagnosed, right? So you find someone being treated for something totally different than what it is, and that's where we suffer from. And like we know, epilepsy and convulsive disorders have a lot of effect in the brain. And we have actually, in our space, we have seen children die. I remember from the project that we have for medicine support, where we tend to meet parents, like 3 months later, a mother with 2 kids or with 2 special needs kids, we just get a phone call that the child died. They had the convulsion. It was the first time, no awareness, because she had taken the child to live with the parents, because you know also disabilities can be expensive, especially for single parents. And that's how we lost the champion. So that awareness, the government should pay more attention to some of these things that we're losing our children and the future generation, and even the current existing and the stigma around it. But then you see those are things that are not being funded per se and not being, spoken about. So we find that we are having a lot of losses in line with that. So there is talks that are going on some of these things, but then, like you said, it is talks. So we're waiting to actually see action being done, and those policies and standardizations being implemented. So we'll continue engaging, and we hope that now the actual departments responsible for it will be able to take it up.
Well, I hope someone from the government is watching this. Listening. So I can see Sharon has left again, but that's okay. Maybe as we move to the end of this conversation, is there anything you would like to tell a person living with epilepsy or a caregiver out there? We can start with you, Sylvia.
For my fellow caregivers, I know it is a journey. I know it's something we wish we could wish away. I know we always told, let's wait for 5 years and maybe it will reduce or disappear. And we hold on to that hope. But let's not give up on that and just say, I'm not going to continue with this. Let's prioritize getting the medications, because we are torn in between, I need to put food on the table and I need to buy this medicine. And there are those days when you know you can't afford it, but we pray and hope that something will come through. But even as we go through all of that, I'd like to encourage my fellow caregivers that not to give up. Don't give up on your child. Embrace them as they are. Don't look at them as for what you would wish or would have wished for them to have been, but for what exactly God gave you. And that way, it will be way easier when you treat them without comparison to others, that this is my gift and I will embrace it and I will mold this child to be the best of what they can be, despite and in spite of what is going on. And that is what will be able to give you focus and the ability to move on. And for the support system and the community, let us learn to embrace people with their differences, because we're never all the same. And the other thing is, looking at the causes of epilepsy, you never know. Maybe 2 years down the line, you would join that bandwagon without even knowing. So be kind, acceptance, and embrace the differences that we have in our society. Thank you.
Wow, such powerful words. Grace.
Thank you. As we wind up, and after hearing some of the experiences that we're hearing here, and knowing that being a caregiver is not an easy task. Dedicating your life to pouring into someone else's cup, growing them, as Sylvia has said, just making this person the best that there is, can indeed take a toll on you as a caregiver, can indeed take a toll on you as a person living with epilepsy. So if at all you do get to that point where you feel like those symptoms of depression, those symptoms of anxiety are getting overboard, or the desire to will to live, or even just feeling at the end and disheartened, just know that you can always reach out for support. And this support can come from the people that are around you or even from a professional. And it's okay not to be okay. Sometimes you get dealt a card that doesn't necessarily make you happy. And understanding that and acknowledging that and getting to the point of acceptance takes its time and takes its toll on you. So if you need support, feel free to reach out to a professional and have someone walk that journey with you. We're here for you, and we're proud of you for doing what it is that you're doing in your own small way. Thank you.
So for everyone who is watching out there, we chose to have this conversation in honor of the International Epilepsy Day that was on the 8th of February. And it has been an insightful conversation. I have enjoyed and I have learned from Sylvia, from Grace, from Sharon as well. Just a message to everyone out there, and it's specifically to anyone who lives with any rare condition. It's okay to not be okay, and even as you fight this battle that is not known to many, I just want you to know that you are amazing, you're beautiful, you're talented, and you're stronger than you think. Another thing that you need to remember is that you got this. And for the caregivers, Kina Sylvia, and the caregivers in the entire healthcare system and even in the world, I just want you to know that you are our unsung heroes, and that you are our pillars. Keep being our pillars, keep being there for us, and don't stop. For the rest of the world, I think it is very important for us to create awareness on matters, rare diseases, and even mental health. It is important for us to let the world know that these things are existing and that these things can be handled well, and that it's okay to not be okay. So help create awareness and stay woke. Thank you.